Hi, my name is Maia Garbrandt. I'm a speech language pathologist graduate student here at WVU. Could you state your name for me?
Yes, my name is Trenton Ashley.
Well, it's nice to meet you, Trenton. So today we're going to be conducting a cranial nerve exam, which tests those different cranial nerves to make sure that they're functioning properly. There are some tests that require me to touch your face and your shoulders. Are you okay with that?
Yeah.
Okay, great. So the first thing I'm going to do is put on my gloves. And then the first nerves that we're going to be testing are cranial nerves 3, 4, and 6, which test eye movement.
Okay.
So the first task I'm going to have you do is just follow my finger with your eyes and don't move your head.
Okay.
Good. So then the next thing I'm going to do is check your pupil constriction. I'm going to be shining a bright light in your eyes. Are you okay with that?
Mm-hmm.
And just look straight at my nose.
Okay.
Good. Good. So the next cranial nerve that we're going to be testing is cranial nerve 5, which deals with our motor and sensories, and also testing that range of motion. So the first thing I'm going to have you do is open your jaw. I'm checking for tension here. Yep, feels pretty tense. Good. So now I'm going to have you open your jaw and close your jaw. Open your jaw, close your jaw, open and close. Good. So now I want you to open your jaw. Don't let me push it shut. Close your jaw. Don't let me push it open. Good. So this is a broken tongue depressor. One side is sharp and one side is dull. If I could show your hand.
Mm-hmm.
This is the sharp side. This is the dull side.
Okay.
Are you okay with this being on your face?
Yes.
Okay. So I'm gonna have you close your eyes, and then you're gonna tell me whether you feel it sharp or dull.
Okay.
And we're going to be testing the V1, V2, and V3.
Okay. That's sharp. That's also sharp. And also sharp. That's dull right there. Also dull. And dull again.
One more time.
And that's dull as well.
Good. Okay, so the next nerve we're going to be testing is cranial nerve 7, which tests facial movement
Okay.
and upper facial range of motion. So the first thing I'm going to do is check for some symmetry. Yep, your face looks pretty symmetrical.
All right.
Now I'm going to have you raise your eyebrows and lower them. And raise your eyebrows and lower them. Raise them again and lower them. So I'm going to have you raise your eyebrows again. Don't let me push down on them. Lower them. Don't let me push up on them. Good. The next test I'm going to have you do is smile, pucker your lips, smile, pucker your lips, and one more time, smile, and pucker your lips. Good. So this test also tests cranial nerve 10. So I'm going to have you fill your cheeks with air, and then don't let me push the air out when I push on it. Good. So now I'm going to use a tongue depressor on each side of your mouth. You're going to bite down on it and don't let me move it.
Okay.
Bite down. Good. Bite down. Good. So the next cranial nerves I'll be testing is cranial nerves 9 and 10. So I'm going to look inside your mouth with the tongue depressor. Yep. I want you to go, ah, ah, ah. One more time. Last time. I'm going to have you go, ah. Again. And last time. Great. Good job.
Thank you.
Now I'm going to have you put your face in your elbow, and I want you to cough.
Okay.
One more time. And last time. Great. And now I'm going to check your gag reflex.
Okay.
Great. So the next cranial nerve we'll be testing is cranial nerve 11, which
Mhm.
has to do with your range of motion.
Okay.
So I want you to shrug your shoulders, drop, shrug, drop, shrug, drop, shrug. Don't let me push down on them. Good?
All right.
So now I want you to look to your left. That sternocleidomastoid muscle looks pretty good. Turn to your right. That muscle looks good again. I'm going to have you turn to your left, to your right. Turn your head to the left, turn your head to the right, and one more time to the left and to the right. Great. Now I'm going to have you look to your left one more time.
Mm-hmm.
Don't let me push to the midline. Turn to the right. Don't let me push to the midline. Great. So the last cranial nerve we'll be testing is cranial nerve 12, which is
Okay.
testing the range of motion of your tongue.
Mm-hmm.
So I want you to stick out your tongue, and then I want you to stick your tongue up to your nose, and then down to your chin. Up to your nose, down to your chin, and one more time, up to your nose, down to your chin. Great. Now I want you to move your tongue, stick out your tongue, and then go to the left, and then stick your tongue out to the right, and then left, and right. Great. So now I want you to push your tongue to the inside of your cheek, and then don't let me push against it. On the other side, and then back to this side, and then back to the other side. Great. All right, well, this concludes the cranial nerve exam. I'm going to take off my gloves.
Thank you.
Yeah, thank you for being my patient.
Absolutely.